Dr. Ryan Vaughn of exhalesinus.com, and with offices on North Perryville Road, joins us. Good morning, Dr. Vaughn.
Good morning.
All right, we've had 69 degrees. We got another sunny day today. Pretty soon things are going to bud and bloom, and we're going to start sniffing and sneezing and
really feeling it.
That's
right.
Now, but do we know what the difference is when this time of year comes around, or any time of the year? What's the difference between like allergies or just an infection of some kind, or a cold even?
Absolutely, right. So one of the things that sounds a little gross, but is the easiest way to determine a sinus infection from an allergy is to blow your nose and look at what it looks like.
Okay. All right.
We're starting right
Good
away
morning.
this morning.
What are we looking for here?
So if it's yellow-green, that's probably an infection. If it's clear, then it's more likely to be just a virus or a cold or allergies.
Okay.
Right. So
then how do we differentiate between if it's clear, virus, cold versus allergies? How do we make that distinction?
Yeah, so I'm going to tell you right away, it's not always super easy.
Okay.
So there's no easy, quick one, but one of the things you can do at home right away is to actually use some medications, like a nasal spray. Over the counter, there's a product called Astapro or Flonase.
Right.
Those are really helpful if it's really just that nose problem where I just really am sneezing, itchy nose, itchy eyes. We really actually want to focus our treatment up into the nose, and that's like where nasal spray is really helpful.
Okay.
If you have a cold, your nasal sprays are not really going to do much, right? Yeah.
Okay.
So then it's more of the like cold remedies
yeah.
that we've talked about before.
Yeah.
But if it's allergy stuff, one thing to be aware of, we think about allergy season as like spring season or fall season. We can be allergic to anything. And so we could have had allergy seasons all through the winter if you're allergic to dust, say.
Okay, good point. Yeah. And
yeah.
And I guess you don't know until you tell your doctor or a specialist like yourself, well, I was in this environment.
Yeah.
And how does one know what one's allergic to as they grow through life?
Yeah, right. So the way that we can figure out what we're allergic to as we're growing through life is going to be allergy testing. And so allergy testing is done in our office, and that would be done usually with one of our providers who's a PA or a nurse practitioner. And so they will actually come in and do a test where they apply little antigens to the skin, and we give it about 15 minutes, and we'll see, is there a reaction to that particular thing? We test.
Excuse me, we're
Please.
talking kind of spring allergies, which usually is trees and flowers, that kind of. But is this testing can be done on for food allergies too?
Yeah, so we can do spring allergies, summer allergies, fall, year-round allergies. We can do food allergies, and we actually will test based on what region of the nation that we're in. But say that someone's a snowbird, right? And they're like, well, I go to Arizona or I go to Florida. We can add in those as well. And sometimes we can do that with the skin test. Sometimes we also do a blood draw as well, just to really get a thorough evaluation.
Okay, so can I get this kind of a voluntary test written off covered by insurance?
Easy, yes,
Okay.
absolutely. Insurances, Medicare, all your insurances are going to cover that without really any questions. The only question may be the blood draw, where we may need to do the skin test first.
Right.
Before the insurance will cover the blood draw.
All right, so allergies change in people too, don't they?
Yeah, it's super interesting, right? So it is our immune system that causes allergies, and our immune system is constantly learning and changing. That's why we can get a cold once, and then the next year maybe that same cold is less intense for us. But we can also develop new allergies. So the easiest example would be, oh gosh, I go to visit Arizona and I'm great for the first 3 months that I'm in Arizona, but then I decide to move there, and next year all of a sudden now I'm allergic to things in Arizona and I have the same problems that I did back in Rockford.
Okay.
Yeah.
Okay. Explain that for me. Why?
Yeah. So first of all, I'm going to tell you that we call this the honeymoon period.
Okay.
But it's your body that has the ability genetically to overreact to, say, cactus, right?
Yeah.
So we can overreact to dandelions here in Rockford, and then we go over to Arizona where maybe we don't have so many dandelions, so we're not quite so reactive, but we see a lot of cactus flowers blooming, okay? Now we're going to start to get that new allergy to that because our immune system has learned something.
Okay. All right. So how do we treat our allergies? Let's say we figure out, okay, we're allergic to trees.
Yep.
How do we can't avoid trees.
That's right.
How do we
How do we treat it?
Yeah.
The best treatment is to avoid it.
Okay. Yeah.
Right,
I just said it's hard to avoid trees.
Hard to avoid trees.
All right. Cut down all the neighbors' trees.
And your own, right? When it's a tree or a grass or something you cannot avoid,
Right.
or let me talk about grass, right? So say you're mowing
Grass,
your
tree.
lawn.
Yeah.
I actually have patients sometimes wearing a mask
Sure,
because we
sure.
really want to be, or take a shower afterwards, right? Okay, next is going to be, what are your symptoms? If they're mostly the nasal sinus type of eye symptoms, then we want to use nasal sprays. So those are going to be your Astapro, Flonase,
again.
Nasonex.
Okay.
If we get
over the counter, that's over the counter.
all over the
Okay.
counter. You don't have to see me for that stuff.
Okay.
If you're using it for longer than a month or so, come see us just to make sure that you're not getting side effects from it.
Okay.
If you have systemic symptoms, that means like itchy skin or hives or wheezing, well, that's when we start to use something like a pill like Zyrtec, Xyzal, Allegra, Claritin. Please, please, please do not use the decongestants. So Zyrtec D or Claritin D, those will actually cause your secretions to be thicker. It raises your blood pressure. It causes kidney problems, heart problems. The
Important
decongestants,
safety tip.
No Ds.
No decongestions with your
Allergy
allergy
meds.
medication.
That's right.
And that's once again over the counters too. Well,
it is, right.
So
right.
we don't need you at all here, Dr. Vaughn.
Right. So where do I play a role?
Yeah,
right.
yeah.
So if you want to know, well, I'm sneezing all the time, but I can't figure out what I'm allergic to. Come get us. Let us test you. Right.
Okay.
Or I need to use my nasal spray every day, and I'm using it for more than a month. Well, let's make sure you're not getting side effects of little irritation inside of your nose that if we catch early is easy to remedy. If we miss that early opportunity, it can be a bigger deal to fix down the road.
Okay. All right.
Yeah.
So step one is to figure out what you're allergic to.
Allergic to.
And that's where Exhale Sinus can come into play with some testing.
That's right.
And you said covered for the most part under insurance.
Covered under insurance. The last step would be allergy desensitization. So that's going to be your stuff like allergy shots or drops that go under the tongue.
Okay.
And we can talk about when that's appropriate when you come in.
Okay. But yeah, know what you're fighting first, I guess.
Know what you're fighting first, because again, avoidance is your best strategy.
Okay.
Yep.
And yes, that's some tips on spring allergy season here from Exhale Sinus. They're on North Perryville Road, 735 North Perryville, Suite 4. If you have some further questions for Dr. Vaughn, give them a call at 977-5715 or go to their website, exhalesinus.com. And yeah, it covers a lot of bases, not just spring allergy season and allergies in general at that website. Thank you, Dr. Vaughn.
Thank you.